Welcome to the Above and Beyond Recovery Podcast, where we explore recovery and its relationship to faith, family, work, community, and health.
Hi, I'm Amber Didden, today's host of the Above and Beyond Recovery Podcast. On today's episode, we'll be exploring how addiction treatment works, what different treatment models are there, and how do you find a model that works for you. Our guest today is Dave Cottrill. As many of you may know, this show is produced by Pennsylvania Adult and Teen Challenge, and Dave is our Director of Counseling Services. Dave, welcome to the show.
Yeah, thanks for having me.
All right, well, Dave, it's so great to have you on the show. Every time I hear you speak about neurobiology of addiction and how the brain works and how the field works, I'm just kind of fascinated by your knowledge on the subject, and this is a topic that I'm really interested to learn more about. So can you start by just telling us a little bit about your background and how you found yourself in the field?
Yeah, sure. My journey with Pennsylvania Adult and Teen Challenge actually started back in 2009. I came through what was then just Teen Challenge as a student, and I graduated the program in July of 2010. From there, I wanted to figure out what in the world was I going to do with my life, and so I started studying psychology. I got my bachelor's degree, and I was blessed enough to be able to actually come back to Pennsylvania Adult and Teen Challenge in 2015 to work as a counselor. And my journey as a clinician really started from there, learning about different treatment models, therapeutic approaches. Started at the counseling level, then I became a clinical supervisor, worked in quality assurance, and now I'm in a director's position, being able to kind of oversee a lot of the clinical programs that we have. So really enjoyable, really fascinating work.
That's awesome. So I think one of the things, I've been in the field for a few years, but not on the clinical side.
Sure.
And one of the things that I never really thought about is the inner mechanics of how addiction treatment works. I think what I knew about addiction treatment was you sit down with a counselor and you talk about it. And that's about it. And once I started learning more about the different methodologies and what is actually happening in those sessions, it's not just sitting there and kind of like letting it out. There's actual theory behind it and reasons why you do the things you do and the questions that you ask. So can you tell us just a little bit, like a brief overview of the different models of treatment and kind of maybe where they come from?
Yeah, sure. I mean, you're asking me to unpack a big box in a very small way. But to kind of get to your point, counseling is a conversation, but it's a conversation with intentionality. And so when we approach counseling, depending on the theoretical model that we approach counseling from, we do so with a specific framework. We use a variety of different approaches here at Pennsylvania Adult and Teen Challenge, including cognitive behavioral therapy. And just to give you an understanding of what CBT is, or CBT is short for cognitive behavioral therapy, it's traced back to behaviorism. Many people have heard of Pavlov and his dogs, where we learn new behaviors by attaching stimuli and responses. We've got opera conditioning. B.F. Skinner, he used to train mice to do different things. Eventually, we had people like Beck and Ellis who came along and said, well, the same principles kind of apply to our thought life as well. And so we learned that what happens to us and around us isn't always what causes us to feel or act. It's sometimes what we think about what happens to us and around us that causes us to think and act, feel and act. Some other things that we use here at Pennsylvania Adult and Teen Challenge is motivational interviewing. There's something fascinating about addiction, and that is most people in addiction are very ambivalent about change. They recognize that they want to change and they need to change, but they also don't want to change. They like their drug. They like, they love getting high, but they don't like the consequences. And so they're kind of on the fence a lot of the time. So one of the things we do is we employ motivational interviewing. We also do third wave cognitive behavioral therapies like dialectical behavioral therapy, which I know it sounds like a mouthful, but really what that means is that we incorporate a lot of mindfulness into some of our cognitive behavioral therapy approaches. And we at Pennsylvania Adult and Teen Challenge, we try to simplify the mindfulness as just non-judgmental awareness of the present moment on purpose. Again, that intentionality, right? And some other things we do is solution-focused therapy. We try to help patients identify some of the resources they've had and coping skills they've had from the past and help them apply those to their current situations. There's a whole plethora of different theories that we actually use in the counseling process. And it really depends on where the patient's at and, what was the counselor trained in.
Okay, so I'm going to rewind you and go back to, let's start with cognitive behavioral therapy.
Yes.
So I understand a little bit of the background. I took my, psych gen eds in high school and college, so I remember some of that I learned.
Right.
But what does that look like in practice? How do you apply cognitive behavioral therapy in a session?
Yeah, really glad you asked that question. The way it's normally applied in counseling session is we help people identify some of those thoughts and some of those behaviors that are contributing to some of the issues that they're presenting with. With addiction specifically, what are the thoughts that are driving you to experience craving? What are some of the thoughts that are driving you to make bad decisions? Can we evaluate those thoughts and ask ourselves, are those thoughts really true or are they not? And if we can start getting you to think something that's a little more true, then maybe we can start changing some of those behaviors and some of those feelings.
Interesting. So is it a lot of like kind of feedback? So you kind of repeat back to the person what you hear them saying and kind of hold up a mirror to that? Am I understanding that
Absolutely.
right
And I like the way you just said that, holding up a mirror to the client. Because I think a lot of us can recognize anybody who's had an addicted loved one or anybody who's been through addiction themselves, they don't like to hear what they need to do. Right? But if we can get them to talk about it and we can simply reflect and hold up that mirror and show them what they're saying and what they're thinking and what they're going through, sometimes they're kind of stuck with the reality. Oh, wait, that doesn't make sense.
Mm-hmm. What are some of the more common misinterpretations that people might demonstrate in a counseling session? Like some of those untruths that they might be telling themselves or expressing, and when you hold up that mirror and say, "Is this what you meant to say?"
Sure.
It kind of shifts for them.
Yeah. And so when we think about cognitive behavioral therapy, we can break down some of these distortions or untruths into a bunch of different categories. Some of which are mind reading and predicting the future. Sometimes we tell ourselves things that, the future is going to be terrible. It's just never going to work out. I'm never going to be able to get this. I'm never going to be able to stay clean. I'm always going to be a failure. Well, they're predicting a future that they don't know, what the actual outcome will be. Sometimes it's overgeneralization, right? Things always happen to me this way, or things never go my way. Well, all right, well, let me ask you, is it really true that things have never gone your way? Tell me one time something has actually gone your way. Is it really as hopeless as you're making it sound right now? And so what we try to do is we try to take some of those distortions and we try to reframe it for the clients and have the clients kind of dispute some of those, distortions themselves.
Mm-hmm. Okay, so I'm going to try to pronounce it.
Sure.
Dialectical?
Yes.
Did I do it right?
Yes,
okay.
Absolutely.
Dialectical behavioral therapy.
Yes.
So give me a definition of that again.
All right, so dialectical behavioral therapy is one of the third wave cognitive behavioral therapies.
Third wave, what does that mean?
So first wave would have been classic behaviorism, and we're talking Ivan Pavlov and B.F. Skinner. Really, it's just all about our behaviors. It's just behavior, just behavior, just behavior. We just learn to have conditioned responses. That's all behaviorism. Then when you have the introduction of Ellis and Aaron T. Beck, they introduced a cognitive portion of this. Okay, well, it's not just about pairing stimuli and getting conditional responses, but now there's also something about the way we think. And so we put those together. We have cognitive behavioral therapy. Now, third wave CBT has really come about later on, where we start incorporating concepts like mindfulness into a lot of what we do. And so mindfulness, as I said, we define that as non-judgmental awareness of the present moment on purpose. And so we are encouraging clients to stay in the here and the now. And there's an important reason for that, because we can get so distracted by the past and so distracted by the future that we don't pay attention to the opportunities we have right in front of us. To allow them to just experience the moment allows them to be able to accept what's happening right here, right now. There's too much pain in the past, and there's too much anxiety for tomorrow, right? There's enough pain in here and now, let alone to have to deal with the past and the future all at the same time. So we want them to just deal with what's right in front of them, right here, right now.
So I know that we use a menu of different treatment approaches at
Right.
Pennsylvania Adult and Teen Challenge. I do hear us talk mostly about DBT and CBT.
Right.
Does it seem like those are the most popular therapies in the field in general?
Generally speaking, I would think cognitive behavioral therapy is an extremely popular modality in the field. I think some of the other ones that are perhaps even a little bit more prominent is motivational interviewing, for one. Again, helping people resolve their ambivalence by tapping into the goals and the motivations that the client has. Instead of us pushing goals and motivations on them, we try to tap into the motivations that already exist within the client. That's motivational interviewing. And the other one is person-centered approaches, more of a Rogerian approach. And that is just kind of meeting the patient where they're at and kind of letting them kind of guide the way, so to speak.
Motivational interviewing, is that a technique that's used mostly in drug and alcohol treatment, or is that used widely in mental health in general?
Yeah, great question. It is primarily used in drug and alcohol. Well, I will say it is used in drug and alcohol, and it is a prominent theory in drug and alcohol, or a prominent approach in drug and alcohol, but it is widely used in other treatment options. The medical field uses it. There's a bunch of different fields that actually apply motivational interviewing to their practice.
Okay. Do you have a favorite modality?
So if you ask me what my personal counseling approach is, my counseling approach is actually built on 3 different prongs. The first is person-centered approaches. I do very much appreciate a person-centered approach to treatment. Second is obviously motivational interviewing, as I was discussing earlier, helping people resolve ambivalence. And then the other is cognitive behavioral therapy. So those are my 3 primary prongs that hold up my counseling practice.
So when you meet a new client for the first time and you sit down and you have a conversation with them, are you kind of picking tools out of that basket and kind of adjusting the levels of each tool depending on the person?
Yeah, absolutely. Which theoretical model I tend to lean towards more will depend on a number of things. First of all, what kind of problem are we dealing with in the counseling session? What kind of strengths and barriers is the client presenting with? I will say that I've counseled clients that have difficulty reading, never really learned how to write. Cognitive behavioral has not been the most ideal approach for them, because cognitive behavioral therapy implies there's going to be a lot of homework, a lot of reading, a lot of journaling, things like that. That hasn't been as beneficial with those clients. And so in those situations, I've leaned more towards person-centered approaches.
Talk about person-centered approaches a little bit more, because in my mind, it seems like any approach is going to be person-centered. So help me understand why that's its own kind of category.
Well, and you'd be surprised. For many, many decades, actually, most of the approaches, especially in the drug and alcohol field, were not person-centered. They were very much facility-centered. And so we, back in the day, in the 70s, 80s, 90s, what we would do is we would bring clients into the room and we would tell them what they needed. And we would tell them how they had to change their lives and tell them what goals they needed to work towards. A person-centered approach just says, hey, listen, let's sit down and talk, and then we'll kind of follow where that person goes a little bit.
Have you ever started down a path with one model and just thought this is not going the right way, and then had to make an adjustment? And
Of course.
What was that like? What kind of tipped you off that you needed to make a change?
I guess really when it comes to the point where we sit down and do a treatment plan update with the clients. At a treatment plan update, what we'll do is we'll sit with the client, we'll review their original treatment goals and say, listen, how are we doing in trying to meet these goals? Are the objectives that we set out actually working? And oftentimes, if we see that those aren't working, then we need to get creative. We need to find a new solution. That can be helpful for the client to say, okay, these aren't working. Maybe let's not reinvent the wheel. If we know this isn't working, then don't do it. Maybe we could also rely on some of the things that have worked in the past. Again, solution-focused therapy. It's really a collaborative process with the client. Like, hey, let's work on this together. I'm here to walk with you. I'm not here to necessarily push you in my direction. I'm here to help you go in the direction you need to go.
So I listened to a podcast a few weeks ago about the use of psychedelics in addiction treatment.
Sure.
And had a lot of feelings about that.
Of course.
But I think what was kind of fascinating to me is that I know that there are drugs that are being used in addiction treatment. Mm-hmm. And I'm always interested in, like, where are the lines and things? Where do you cross lines, and what becomes harmful versus helpful? And so I'm just curious about your thoughts on that. Have you studied that at all, thought about it at all? And
sure. So I think what you're trying to get at is this idea of medication-assisted treatment, mm-hmm. right? And medication-assisted treatment is becoming more and more popular these days, and I think for good reason. But again, you talk about some of these fringe things. You talk about the use of psychedelics or, maybe medical marijuana, something like that. I think medication-assisted treatment is just that, okay? It's medication-assisted treatment. And I think we can think about whether or not it's good or bad for a patient in those terms. Is the medication assisting with the treatment process and helping the client move towards their goals? Okay, so if we're going to use medication-assisted treatment, some of the medication-assisted treatments that we use here at Pennsylvania Adult and Teen Challenge is like naltrexone and Vivitrol, which really helps block some of the substances that would attach to those receptors in the brain that would excite somebody when they get high. And then we also use partial agonists like buprenorphine. And what buprenorphine does is also sits on those receptors, but it allows the persons to experience a reduction of cravings. When they experience a reduction of cravings, this person is more fully able to engage in the treatment process, engage in groups, because their limbic system is not screaming, we need to be filled with drugs. Their prefrontal cortexes can now begin to make some rational decisions. And what do you know? People can actually engage in things like process group and individual counseling and start moving towards the therapeutic goals they set forth in the treatment plan. So really, kind of long answer to a short question, like what is my philosophy on medication-assisted treatment? If the medication can assist somebody in moving towards their treatment goals, I think it can be absolutely beneficial. If it's going to hinder them from moving towards their treatment goals, it's not going to work.
So the more traditional versions of medication-assisted treatment that you and I are a little more familiar with.
Sure.
You're saying, and I'm reaching back into my early psych classes here.
Yes.
But you're saying that the limbic system, which is kind of like the lizard brain, am I right about that? It's kind of
Sure.
like the primitive,
right.
Like almost needs-based. Am I kind of in the right realm there? It's like your basic instincts.
Yeah, so our limbic system is actually, to be more specific, a collection of different regions of the brain. So we all know that different regions of the brain are responsible for different functions. The limbic system has a whole bunch of functions, and so what it does is this system is a collection of these different regions. We have things like the amygdala, which is responsible for allowing us to experience the fight or flight syndrome associated when we have when we're facing a threat. It has the ventral tegmental area, which is our dopamine pump, or the basal ganglia.
Say that one more time. What?
Ventral tegmental area.
Ventral
tegmental area.
Okay, I'll let you say it.
Yeah, basal ganglia, which is really important for us developing deeply ingrained habits. A lot of these things are really involved in the process of addiction and recovery. We also call there's a portion. We also have the limbic system is also referred to as the reward system or the pleasure system of our brain. And so what happens is when we experience pleasure, pleasurable activities, it's something that our brain learns to do over and over again. Now, our brain, when it communicates to us a need, since it is deeper down in the limbic system, it communicates to us through overwhelming emotion, desires, impulses, and cravings. Now, that's what we would call the go system of our brain. It tells us to go do something that is pleasurable for us because we interpret pleasure as something important for our own well-being and survival. But we also have a stop system, and that's the prefrontal cortex. And that's the thing that allows us to veto bad decisions. Unfortunately, when the limbic system gives us the overwhelming urges to go and do something, in the process of addiction, the prefrontal cortex begins to lose its capacity to veto some of those bad decisions. It loses its influence over other areas of the brain. And really what happens is the limbic system overlearns this process of addiction as necessary for survival, which is why we always hear guys talking about, well, I feel like I need it to survive.
So you're saying that what medication-assisted treatment, or MAT, might help to do is kind of regulate that limbic system so that the other systems in the brain that are more conducive to recovery can kind of like take a front seat.
Exactly.
Okay.
We can calm the limbic system's signaling down by no longer needing to communicate the need to fill these receptors with dopamine through the communication means of overwhelming cravings. And now the prefrontal cortex, we can allow that to have some work. We can get them to settle down, begin to make rational decisions. We've really seen a lot of guys benefit. We've seen people who never would have considered a long-term discipleship process ever in their lives now commit to a long-term discipleship process because they were able to get on MAT and engage in counseling and recognize what the best decision was for them.
So MAT is a tool in the toolbox along with some of these other modalities like DBT, CBT.
Correct.
They work together.
Yes. Medication is not sufficient in and of itself. It's medication-assisted treatment.
So another tool that we have in our toolbox, especially here at PATC, is the faith element. Can you talk a little bit about how faith may play a role in recovery treatment?
Of course. Faith is huge. Faith is huge. First of all, from a Christian standpoint, we recognize that we could help people stay clean all day long, but that doesn't do anything if we don't introduce them to Jesus. They might be able to spend their lives clean and sober, but it doesn't mean they're going to spend eternity with the Lord. And so we want to be very mindful of that when we're approaching clients. But from a much broader perspective, when we look at the field, the drug and alcohol recovery field is in itself very spiritual. We think about the 12 steps, right? Come to acknowledge that that our lives have become unmanageable because of the substances we use. We need to recognize that there is a power greater than ourselves. And even in the 12 steps, they say that we got to submit our lives to that power. That is a very spiritual aspect. The recovery field is very spiritual. And we try to help people explore, what does that actually look like in your recovery process?
So if you are somebody who needs help with an addiction and you're struggling and you're trying to find a way to get help, how does someone discover what kind of treatment works for them?
I will say that there's a lot of evidence-based practices. And so the reason that Pennsylvania Adult and Teen Challenge employs the practices that we do, including medication-assisted treatment, motivational interviewing, cognitive behavioral therapy, is because studies have shown over and over and over again is that those are the treatments that work for the greatest portion of the population on a consistent basis.
What would you say to someone who says, I've been to rehab before, it didn't work for me?
Keep trying. Keep trying.
And if they feel like maybe they're in counseling and, like you said, they're not reaching their goals and they're not really sure what to do, how would you empower that person to maybe find something that works for them better?
Sure. I would say take a look. What are your goals? You got to figure out what your goals are before you can figure out how to get there. It's like creating a roadmap. The first process in a road trip is figuring out where your destination is. If you don't know where your destination is, you're probably not going to end up at your destination. Right. So the first thing is to figure out where your goals are, and then explore your options. What are your options out there? Do you want to go to a place that really emphasizes cognitive behavioral therapy, or that residential treatment center that has dialectical behavioral therapy skills training? Or do you want to go with a little bit of a different route? Those things all really, really matter.
Well, you said something a moment ago about keep trying. Mm-hmm. And I could imagine for somebody who is struggling with addiction, you must get to a point sometimes where you're just like, I'm tired of trying. Right. Have you seen people push through that part and get to the other side of it?
Absolutely. Yeah. And that's where the reward is in the counseling field. Unfortunately in counseling, when you're kind of in the grind and you're meeting with these people day in and day out and you're tackling ambivalence on a regular basis and you're dealing with people who really don't know whether or not they want to change, sometimes you feel like you don't know if you're making a difference. But then we can see, especially here at Pennsylvania Adult and Teen Challenge, see people crossing the stage after 12 months of submitting themselves to a long-term discipleship process. And you see how radically different these people are. People who, when they first came into a short-term program, were screaming at their families and who were clawing their way, trying to not go into a long-term discipleship process. You see these people walking across the stage and then sometimes even saying, hey, listen, I'm willing to stay on as an intern. And, I want to start working in this ministry. Those are really the rewarding opportunities we as clinicians have in this field.
Yeah, it just boggles your mind when you see that happen, especially when you see the person on day one,
right,
and then see them again a year later. It's a complete transformation.
Yeah. It's great.
Before we close the show, we like to talk about the habits that we're making this week that are helping us find wholeness in our lives. Dave, what's your wholeness habit of the week?
Yeah, thanks for asking. My wholeness habit for this week is really getting involved in my small group at church. My small group is really like extended family to us, and I really don't know what we would do without them. So that's where discipleship occurs. That's where, we pray together, we serve together, we live together, eat together. Yeah, that's my wholeness habit for this week.
How long have you been in that group?
This specific group, probably going on 3 years now. The group has evolved a little bit.
So they're like watching your kids grow up and
exactly.
like really involved. That's awesome.
So,
well, my wholeness habit is kind of similar. I don't know how I got this far in my life before realizing that friendships are a need of mine. I think I just kind of like went about my life like, I don't need to make time for spending time with my friends, but I've really tried to be intentional lately about making time and scheduling and figuring out childcare so that I can just go and spend time with my friends. So that's my wholeness habit of the week. Well, that's it for this week. Dave, thanks so much for joining us.
Thanks for having me.
And to those of you listening, don't forget to leave us a comment or email us with any questions you might have at AboveBeyond@paatc.org. We're looking forward to hearing from you.
Thank you for joining us. The Above and Beyond Recovery podcast is a production of Pennsylvania Adult and Teen Challenge. If you or a loved one needs help with addiction, call us now at 844-888-8085 or find us online at paatc.org. That information is also in our show notes. Join us next time as we continue the conversation.